The hopes that you bring, the dreams that you share, the pleasure you get when you know that we care, the faith that you place, the trust that we share, the joy in your heart when you know that we care. You before we, as USV. You before we, as USV.
USV, your reliable healthcare partner.
Hello viewers, welcome to this discussion in our 4-part series called Beat Diabetes. We all know that diabetes is widely prevalent in India. We also know that diabetes and its complications can be difficult to manage and treat, and at times even devastating for the individual, family as well as society. The focus therefore has to be on prevention. And to discuss various aspects of prevention, we have an illustrious panel for you today. To my left is Dr. Ramachandran from Chennai. Next to him, we have Dr. Seshadri. Next to him is Dr. Unikrishnan. And then, moving further west, we have Dr. Manoj Chadda. So, before we go ahead really, what are we talking about? Dr. Ramachandran, you have a lot of experience in this area. Can diabetes really be prevented?
Well, the short answer to this question is yes, diabetes can be prevented. The reason why I am telling diabetes could be prevented is because diabetes in adults is actually caused by two important factors. One is the genetic risk that you inherit from your father or mother, and then even though you have a genetic risk, the development of diabetes depends upon many other modifiable risk factors which you acquire during your lifetime. For example, there is a strong association between obesity and diabetes, sedentary life habits, which means lack of physical activity, and then if you also develop a big obesity in the paunch or central adiposity, as well as even chronic mental stress. So, these are the factors which actually make you finally become a diabetic. It depends upon whether you get it at the age of 20 years, 40 years or 50 years, depending upon these risk factors. Now, the good thing about this is that these risk factors are modifiable to a large extent. So, there has been large research trials to see whether we can prevent diabetes by taking up people who are at high risk of diabetes. One example is the Indian Diabetes Prevention Program, in we recruited people who have a high risk of diabetes called pre-diabetes. It's called impaired glucose tolerance, where the blood glucose is in a gray area, not normal but not diabetic. Therefore, we took them and then randomized them into control group and intervention. Intervention was lifestyle modification of changing their dietary habits and also improving their physical activity. What we found was that within 3 years, there was a 30% risk reduction in the development of diabetes. That is in 3 years within the trial period. Now, some people could argue that we only postpone diabetes, but in my view, even if you postpone diabetes for even 10 or 15 years, it is actually a lifetime advantage that you live without diabetes or the risk of the complications of diabetes. So, the answer to the question is yes, diabetes could be prevented.
I think that's very impressive, that a disease we all fear, you can actually prevent by simple lifestyle measures. You mentioned a bit about obesity, and I'll drag you into this, Krishna. What do you think about the impact of obesity on diabetes? What's the connect?
Thank you, Ambrish. I'll take off from where Dr. Ramachandran left. He mentioned about obesity as a modifiable risk factor of diabetes, which means that the moment you say modifiable means you can change it to your benefit. Now, the relationship between obesity and diabetes has been discussed for many years, and large population studies have shown that obesity, which is basically being fat, precedes diabetes by at least a decade. In many countries where populations have, through adoption of Western lifestyle, high amounts of fat in the diet or carbohydrates in the diet, changing to a more fast food kind of environment, have found that their populations become fatter, and 10 years later they find diabetes, and a little later they find heart disease. So, in India, this is a little more acute and a little more problematic, because Indians seem to get the same risk of diabetes at lower weights. So, for example, we use a measure called body mass index, which is the weight of a person divided by the square of his height in meters. Now, for the rest of the world, if you're more than 25, you're overweight. For someone in India, if you're 23, you're overweight because your risk is the same as someone who is a Western person with a BMI of 25. So, in India, obesity is a double whammy.
So, quite clearly, obesity is a major precursor for diabetes, and in fact, it's one of those preventable things. And unfortunately, actually, Indians seem to get metabolic complications at lower weights, and that's largely because we seem to collect our fat around our tummies. And because of central obesity, central fat, which is the bad type of fat, we seem to get into metabolic complications like diabetes earlier than our Western counterparts. So, this is about the scene here. You want to add anything about impact of the intrauterine environment? What should pregnant women be looking at? Is there any issue there?
See, and the silent epidemic in diabetes that is also going on is the very, very high incidence of gestational diabetes. A lot of our women are obese during pregnancy. They have other risk factors. They develop diabetes during pregnancy. And as much as we thought in the past that it probably does not have a great impact except on the weight of the baby, we now know, and through good trials done in India itself, we now know that the mother's metabolic environment in pregnancy, her sugars, they program the child into a certain way that this child develops diabetes as an adult. So, it happens right there in the womb.
So programming happens in the womb, and women who had gestational diabetes are likely to have children who have further complications, like, or they're more prone to obesity and diabetes. Can we do anything about it? Dr. Unnikrishnan, would you like to highlight something about what we can do about preventing diabetes?
I think one of the highlights of preventing diabetes is diet, of course, diet control, and of course exercise. When we talk about exercise, there are two aspects which I'd like to highlight. One is physical activity, which is, you don't take the lift, walk up the stairs, park your car a little farther so that you can walk to work. And the other aspect of that, so it's important to incorporate physical activity into your day-to-day tasks. So that's an important aspect of exercise. The other aspect is structured exercise, so which means 30 minutes of exercise per day, aerobic exercise, which means moving your joint, swimming, walking, cycling. So these are all forms of exercise. In addition to the structured exercise, I'd like to bring in the concept of the additional strength training, and that includes stretches. But another additional exercise which people could do is yoga. So yoga has important benefits on stress as well as cardiometabolic parameters like hypertension, and also very importantly, it can improve quality of life. So I think all these things come in under the banner of exercise, and all these things go a long way to prevent diabetes, of course, in addition to diet control.
So we know how important a sedentary lifestyle is in pushing or fueling this epidemic of diabetes, and we know ways to get around it. Not very complicated, pretty simple, as Dr. Unni put it. Can we move to Dr. Chadha from Bombay now? What dietary advice do you give to your patients?
We're pretty convinced that we need to try to keep the body weight at normal for his height, and Krishna talked about the BMI concept. So I think the take home points should be try to have a balanced diet. That means there should be the required amount of carbohydrate, proteins and fat. Before going into what is each one, I think what is important is you should have a caloric distribution. You should have small spaced out meals. Instead of saying I'm very busy, I can have just one meal or maybe 2 meals a day. It's good to have 5 to 6 spaced out meals, because that reduces the load on your body, specifically on the pancreas. Now, when we go into what exactly to eat, probably carbohydrates is the basis of our Indian diet, and we do tend to overdo that. So restrict your simple carbohydrates, that's your sugar and maybe the rice part of it.
All the sweets, you mean? All the goodies?
Sweets, yeah, you need to restrict that.
Wow.
And instead, you have complex carbohydrates.
And I'm not a diabetic yet.
No, but
so
we still would. So let's, I think, as Dr. Ramchandran said, we are a race which is prone to diabetes, and we get it at much earlier age, at much less weight, and all the parameters. So you have to, I would go to the extent of saying that as an Indian, we all should follow this dietary advice. Simple sugar should be avoided. An occasional piece of dark chocolate or a peda during festival is acceptable, but more complex carbohydrates, maida should be an absolute no, and instead wheat, or like in lots of parts of a country, jowari or bajra would be still better. Something difficult to digest is good for health. The Indian diet often tends to be protein deficient. So, we need to increase our protein content, whether it is in the form of pulses, which is good for vegetarians. Milk products also is a good source of protein for vegetarians. And if you are a non-vegetarian, I have nothing against having non-vegetarian food. Probably what is a problem is the fat that goes and the method of cooking food. So, there is a defined amount of oil, ghee that everyone is supposed to be having. We should avoid trans fats, that means the dalda type of oil and ghee in that. But regular oils, whether it is monounsaturated or polyunsaturated, is pretty acceptable, like I said, in defined amounts. And a simple way, a simple formula is to use half kg per head per month. After that, you can just use whatever you want, but the quantity comes first. The quality or which oil would be a later discussion.
Well, thank you. It's time to take a short break, and we come back with lots of more information. Stay tuned.
The homes that you bring, the dreams that you share, the pleasure you get when you know that we care, the faith that you place, the trust that we share, the joy in your heart when you know that we care. You before we at USV, you before we at
USV, your reliable healthcare partner.
Welcome back, and we continue our discussion on how to prevent diabetes and its complications. Dr. Ramachandran, we've talked about diet and exercise. Do you think medications have any role to play in this?
Yeah, before coming to medication, I just want to add something to what Manoj said about diet and prevention of diabetes. Now, we are talking about changing your dietary habits in people who are not having any disease. So, one of the things that we found from our prevention trials is that you got to change a little into the family diet pattern. It is not an individual we are going to treat, we are going to see this, treat the whole society.
Absolutely.
So, the people who actually decide about what to buy, what to eat in the house is actually are the children. So, one of the ways of actually preventing obesity in adulthood is to prevent obesity in childhood. So, therefore, we have to make our children understand that sugar, sweets, butter, chocolate, ice cream are not the right, good, healthy food. It is actually should be take lots of fruits and vegetables and dal and protein. That concept has to come into the family so that the change in diet will be easier for adults to do, so that even children will follow that. That's the one point I want to just say about lifestyle modification. And we have found from our prevention trials that actually dietary changes are easier than making people to do physical activity. As Unishan said, it is very difficult to tell somebody you start walking, you do start tennis, but it is easier. They can do a simple changes in your daily life when you're working in places, walking a little more, not taking the lift, etc. Well, coming to drugs for prevention of diabetes, in all the research trials, we have used drugs along with or without even lifestyle modification. But the best thing is lifestyle modification. That's the most powerful tool to prevent diabetes. But certain drugs like metformin, which is an insulin, is a medicine which actually improves insulin action. Acarbose or alpha glucose inhibitors in a very large trial. These are medicines used for diabetes which prevent the rise of blood glucose after taking food, and other insulin sensitizers called glitazones. All these have been used in prevention of diabetes, and it has been found that these drugs are almost as good as lifestyle modification, although you are taking a drug.
So while lifestyle continues to be the mainstay, in selected cases based on your doctor's advice, even medication can be used to ward off diabetes for some time. We are talking of diabetes and prevention. There is a stage called pre-diabetes, as we all know. This is the stage between normal and diabetes. So, these are blood glucose values that are somewhere in between say 100 to 125 fasting blood glucose or a post glucose of above 140. Do you think these are important areas? I mean, do all pre-diabetes head towards diabetes?
So if someone comes to me with a pre-diabetes value, I actually think that he's been given an opportunity, because diabetes can sneak upon you and come in and hit you full on the face. So when someone gets this pre-diabetes, it's an opportunity. It's a warning. It has an increased risk of certain complications, but in many ways it's an opportunity, because it's given you a time from which you can actually make changes. You could make some simple changes to your lifestyle, make changes necessary with medications, and actually ward off diabetes. And I just want to add two things here. One, making graded changes to your life. Second is the role of family. I think a family that stays together, that eats together, stays together, and it's here also. Absolutely. Just bringing the family in together, talking to them, having a discussion with the family, also the physician involved, and making those graded changes that are required in your life. Simple things like Dr. Unnikrishnan said. I just wanted to add one more thing. Sitting is the new smoking. So let's get up, pull our socks, and this is really an opportunity. I'd like our viewers to not take of pre-diabetes as a threat. Yes. It's an opportunity that's played to our strength. We can make changes and become better.
So sitting is the new smoking, you heard. So despite all efforts, Dr. Unnikrishnan, a lot of us develop diabetes. We develop diabetes, maybe we've been careless, maybe we've been careful, still it happens. So what happens then? We just go on medication and stop worrying about lifestyle? What should we do?
I think it's an important point. If somebody is newly diagnosed to have type 2 diabetes or diabetes, I tell them not to worry, because by intensifying diet control and exercise, there is an opportunity to actually reverse diabetes. So you have an opportunity to reverse diabetes if you intensify diet and exercise. At the same time, even if medicines are needed, you can minimize medicines by just dieting and exercising. Like Dr. Krishna was saying that sitting is a new smoking. There is some people have also quipped that sugar is a new cholesterol, and carbohydrate restriction works very well in the early stages to actually reverse diabetes. But a balanced diet is also, as Dr. Manoj said, very important.
Dr. Ramchandran, you want to list what are the main complications of diabetes?
Well, once you get diabetes, why should you treat diabetes? The reason why we treat diabetes is that diabetes can cause complications specific to diabetes, as well as it also produces increased atherosclerosis. That is narrowing of the large blood vessels, which can have an increased risk of getting heart attacks, you have an increased risk of getting a stroke. Therefore, people with diabetes have a twofold increased risk of getting a heart attack or a stroke because of the changes occurring in the large arteries. But more specifically, diabetes affects small blood vessels, which can affect your eyes and the kidneys and also your legs. Therefore, what is called diabetic retinopathy, which can produce actually blurring of vision and also loss of vision. And the hallmark of diabetic kidney disease is actually protein being leaked in the urine. In the legs, many people with diabetes would have heard that they get foot infections and sometimes even amputations. The reason people with diabetes get foot problems are three. One, there is a decreased sensory sensation in the feet because of specific diabetic neuropathy. So when you are walking, you don't feel where you are walking, and therefore you are more prone for injury and trauma. And then you get ulcers, and then infection starts, and then there is decreased circulation. Then there is some deformity, so when you walk, you have increased pressures in certain parts of the feet. So therefore, there are specific complications of diabetes. However, the best thing is that the most important thing is that if you control diabetes properly, take care of diabetes from the beginning, you can actually reduce the risk of all these complications of diabetes.
Krishna, in one line, can you tell us what can we do to prevent our eyes and kidneys?
Two things. One, the window of opportunity does not close the moment you become a diabetic. The first few years are crucial. Get your blood pressure down, get your sugars down, get your cholesterol down, and you don't have to see any of these stuff.
And what about the other large vessel disorders, particularly the feet, which can be pretty troublesome? What do you say, Dr. Chadha? What can we do to prevent our feet? What can a diabetes patient do?
All the complications that we've just discussed, I think foot problems are something which are highly and easily preventable. One of the first habits that we should change amongst us is barefoot walking. We do it for a lot of social and religious reasons, but if you wear good footwear, comfortable, and avoid using the Hawaii chappals, which is I think probably very bad. Try to keep your feet clean, soft and dry. Using a moisturizer and emollient at bedtime is a good habit. Taking care of your nails and see that you don't cut them very close as you do with your fingernails. Try to keep them a little out. It would prevent the problem what is called as ingrown toenails. Simple preventive measures would go a long way in keeping your feet healthy.
So as we all say, we tell our patients, treat your feet like your face. Spend some time on your feet, at least 1/10 of the time you spend looking at your face every morning. I think we need to close this out here, but before we finally close, I would request Dr. Ramachandran to give one line about the use of newer technologies in preventing diabetes. He has done research and has some experience in this area.
As you said, lifestyle modification is important in preventing diabetes and also treating diabetes. But in order to do that, all of us need constant motivation. And all of us carry mobile phones. So one of the studies that we studied, what is called Indian SMS Diabetes Prevention Program, in which we took people at a high risk of developing diabetes and sent SMS through the mobile phones for 2 years, and we prevented diabetes by almost 32%. So this is the first example of a clinical outcome using mobile technology in diabetes or in medical field, because nobody has used that before. So I think mobile phones have got a health role to play.
So huge potential there for use of newer technologies, and I request Dr. Unnikrishnan to make one last comment before we finally close this discussion for today.
I think diabetes, the diagnosis of diabetes is a chance to become disciplined, to follow diet and exercise, and test annually for disease and its complications, and that protects us, because that is a message that internally wires us to take care of our health, and therefore it's an opportunity to actually prolong life and improve health.
So diabetes can be an opportunity, not necessarily a threat. We need to work together to improve lifestyles, to get our tests done if we are at risk, even if we don't have any symptoms. If we do have diabetes, monitor regularly, check carefully, don't wait for symptoms, and you can surely prevent diabetes, or if you have it, you can prevent its complications. Thank you very much.
The hopes that you bring, the dreams that you share, the pleasure you get when you know that we care, the faith that you place, the trust that we share, the joy in your heart when you know that we care. You before we, at USV, you before we, at USV.
USV, your reliable healthcare partner.